having said all of that, my first and foremost preference for ACC patients always is to prioritize clinical trials if they're available, because this gives patients access to more cutting-edge drugs. It identifies the fact that we really don't have clear data about which drugs do or don't work. And it expands the number of opportunities or options that ACC patients have. So as I said, our institution and many others in the United States and throughout the world are now increasingly aware of the need to develop drugs for patients with ACC. And you'll often find more than one phase 2 trial that potentially could be indicated. So in terms of research directions, I'll just divide it up into several different categories. Okay, the first is just clinical trials that develop specifically for ACC. So these are ACC-specific phase 2 trials that we or others will develop. Those obviously would be of interest for patients with adenoid cystic carcinoma. So those drugs are being developed because there's a biologic reason or a clinical reason why we think those agents potentially could be effective. Now, just to take a half step back, the experimental trials are experimental for a reason. It's because we may have good ideas about why these drugs may be effective, but we don't know for sure if they're effective and safe for ACC patients. So your participation in a clinical trial is to get at that answer, is to really understand how effective and safe drugs are for ACC patients. The second would be what I would term genetically driven trials. So even though patients with ACC is a different disease than a patient with lung cancer or a different disease than a patient with thyroid cancer or ovarian cancer, sometimes knowing the genetic profile of your tumor will lead us to an idea or a clinical trial that we wouldn't normally have thought of. So even though cancers that arise from different places in your body are different, they can sometimes have shared mutations. And if a certain mutation suggests that a drug works well in melanoma, well, then maybe it's a good idea to test that in a clinical trial for ACC. So we oftentimes will do genetic profiling for our patients with ACC tumors just to see what the mutation profile looks like, and does it nominate that patient for a particular clinical trial approach that we wouldn't have necessarily thought of for ACC.